Hello, everybody. I am letting everybody into the room right now. We will be getting started shortly. Let's see here. We'll start in 30 seconds after I let everybody in. Okay, good morning, everybody. Welcome, everybody, to our February VUSD Special Education District Advisory Committee meeting. We are both on Zoom and streaming on YouTube. Give me a second. I'm still letting people in as they trickle in. Okay. Do that. So yeah, for new viewers that may be wondering what this is all about, a quick little bit of background. SEDAC is an advisory committee that contributes parents' voices and feedback to the work the district does through collaborating among parents, school sites, and district administration, helping to inform the development of practices to meet the need of all learners, providing the community with insight into the special education process, and broadening of awareness of available resources for our families, our site representatives, and have a stake in the sharing of information with their school communities in order to foster district-wide connectedness. So yes, we are glad again that you are here today. Let me make sure everybody is in the room. The first thing we'd like to do is we'd like to do the Pledge of Allegiance. So let's all stand for the Pledge of Allegiance. Okay, ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you guys for doing that. The next order of business is we are going to do roll call, and that is going to be me today, who is going to be doing the roll call. So here we go. If you can say if you're present, that would be great. So we're going to start with Balboa for Leslie Hinanosa.
Present.
Thank you. And Shauna Swanson. Okay, we're going to go to Buena for Michelle Hoslam.
Here.
Cabrillo for Carrie Kaufman. Let's go to Citrus Glen for Lisa Williams. Let's go to Data for Dora Herrera.
Good morning.
Hello, nice seeing you. EIC will be Sabrina Reagan. For Elmhurst, Ashley Pope.
I'm here.
Thank you. For EP Foster, it'll be Nancy Olaskugaga. I'm having trouble with the last name. Sorry about that. Let's go with Foothill for Melissa Lalem.
Here.
Jay Sarah for Liz Marshall. I'm going to go back out to Elmhurst for Jenna White, if she is here also.
Here.
Thank you. Juana Maria, Linda Crockett.
Here.
Lemon Grove, Sue Lynn Ruvalcaba. And Katie Lovato. And for Pierpont, Kim Cabrero.
Good morning. Present.
Hello. Poinsettia, Laura Reyes.
Good morning. Also for Pacific High.
Thank you. Okay. And also Carolyn Gregorio Grimm for Poinsettia. Okay. For Portola, Geraldine Monroe. Morneau, sorry. Yep. For Sunset, Christy Price.
Here.
Thank you. And Cassie Harris. And for Ventura, Esmeralda Hernandez. And Will Rogers, Rachel Dreher.
Here. Good morning.
And last but not least, our school board representative, Sabrina Rodriguez.
Hi, good morning, everyone.
All right. Thank you. And thank you all again for coming on. We have a packed agenda today. We are very excited to have you come on. And then obviously we'll have time for some comments and committee reports and public comments if there are any. And yeah, so again, happy Friday. What we're going to start with today is we are going to, let me see, I'm letting people still come on in. There we go. We have we're going to continue our discussion about the spectrum of our special education services. And let me see here. Before we actually, we're going to go to committee reports after that. So the first thing we're going to do is we're going to have one of our program specialists, Katie McCarroll, and she is going to give an overview of emotional disturbance for special education. So Katie, I believe you are in here, correct?
Correct.
See. You are.
I'm here.
So let me introduce you too. So Katie, introduce yourself.
Good morning. I'm Katie McCarroll. I am one of the program specialists for our ED programs, emotional disturbance programs. And I am just across the board and across the district in regards. I'm not sure if I've met any of you, but hello.
Thank you. Let's also have Stacia Helmer introduce herself.
I'm Stacia Helmer, and I'm the program specialist for the moderate to severe special ed program here at the district.
Thank you. And what we're going to do is they're each going to be presenting on different programs within our school district for special education. And I'm going to have Katie go first. So Katie, do you need me to share your slideshow?
No, I have access.
Okay.
I'm gonna do
If you'd like to do that.
that. Okay, let's see here. All right. Okay, so I'm going to just give you a little overview of our emotional disturbance program here in the district. All right. So our program overview is just our ED programs within the district provide a sheltered environment. It's designed to support students with social, emotional, and behavioral needs. It specifically addresses the individual needs of our students from kindergarten all the way up to 12th grade who need a smaller, more structured, and sheltered setting in order to access their education. The way that they're referred over to this program is through their home school team, through the IEP process. In regards to some of the mental health supports that we have within the program, we work closely with Ventura County Behavioral Health and to meet the needs of the social emotional, and it's just not in our program. Of course, Ventura County Behavioral Health through ERSIS also supports all special ed students across the district. In regards to our program, each class has an assigned VCBH clinician to each site to help support the program. So so what that looks like is there are five different school sites that house an ED program. Our elementary is at J. Sarah Elementary. There's 2 classrooms there, one that's K through 3, and then one that's 4 and 5. And we have an on-site clinician there for 3 days a week. Anacapa Middle School has 1 classroom, 6 to 8. And there is 1 clinician there 3 days a week as well. Cabrillo Middle School has 1 classroom, same setup, 2 to 3 days a week of VCBH support. Buena High School has 1 classroom, and there's 1 clinician there, and she's there for 3 days a week. And then Ventura High School has 2 classrooms. It is one of our bigger sites, and they have a clinician there from Ventura County Behavioral Health helping support 4 days a week. One of the biggest things that we focus on within this program is collaboration. So are huge on collaborating with parents and students and teachers, the general ed teachers as well, specialists, paraprofessionals, administration, and of course our VCBH clinicians. As always, the goal for our students is to help support the students in order to return them back to a less restrictive setting. What I also wanted to mention is that within our ED program, we strive as much as we can to integrate them within the general education setting. We really get a lot of opportunities to do that, especially once they hit middle and high school, because they can have anywhere between 1 to 5 classes in the ED program, but some students have 1, some have 2, some has 3. It's all individualized, but the ultimate goal is to kind of return them to a less restrictive setting. Okay, does anyone have any questions for me in regards to the ED program? Okay.
We do have Dr. Dreher. Can you has her hand up? You can ask your question.
Yeah, I was just wondering the class size compared to other special education programs. Is it even smaller or is it about the same?
Well, I can tell you that it differs every year and throughout the year, depending on the referrals. Right now at our elementary school, it ranges from 4 to 6 students in each class. Middle school, at both school sites, currently have 7. And then high school, of course, that's a little bit higher. Buena usually has between 12 to 14, and then Ventura High usually has anywhere between 18 to 22.
Thank you.
You're welcome.
And Katie, can you kind of go over the process from beginning to end, as if we have a student that say qualifies under the special education eligibility of ED, what does that process look like where we're making determining factors if they should stay at their home school or move into the ED program?
Sure. So let's just say the student has already been identified as a student eligible for special ed under emotional disturbance. We do have quite a bit, I would say probably about, 70 to 80% of our students are not in a specialized program that are eligible under ED. So just because they're eligible under that category, that doesn't necessarily mean that they need a more restrictive setting. And so usually what will happen is once they become eligible for under ED, then the school team will look to see whether or not they need additional services. So sometimes they'll look at mental health supports at their home school within a less restrictive setting, of course. And so they'll look to see if they can benefit from social emotional support, such as through Empire and or Ventura County Behavioral Health through URSIS. And then, of course, URSIS is educationally related social emotional services through Ventura County Behavioral Health. From there, let's just say that, yes, that student does require additional supports in order to benefit from their education. We would also be inputting a behavior plan and implementing that with the idea of always trying our best to keep them in their home school in a less restrictive setting before we consider an alternate placement. And then from there, should they continue to need some supports, if it's more of a external thing where they need behavioral supports, then the team would be looking at a functional behavioral assessment. Again, with the idea of how can we keep the student in a less restrictive setting. Should they require more supports from there, then the school psychologist at that school would reach out to me, and then they would request a case presentation So, and then what that looks like is, let's just say I'm just going to pick a school, at Will Rogers. So the Will Rogers team would be invited to a case presentation with whichever, well, in this case, it would be JSerra. And they would kind of give us some feedback on the student. They'd send over referrals. We'd have access to their educational file, and we'd be able to talk about the student. And then from there, the team would determine whether or not the student would benefit from proposing a change in placement to a more structured and a smaller setting, the ED program. And then, of course, from there, they would have an IEP meeting, and I'd be invited, and so would someone from the receiving school.
Thank you. That was a very articulate answer. Thank you, Katie. Appreciate that. Ms. Reyes, you have a question?
Hi, yes. You sort of answered it for the most part as you went through that, but I just wanted to know what type of behaviors kind of qualify students for this program. Like, what do they, truly consider for this?
Yeah. So ideally, what we'd be looking for are the more internalizing behaviors, such as usually these students have anxiety, depression. They're having trouble coming to school. And when I say this, I don't mean like where because we can say that about a lot of our population, but I mean like where it's to a point where these are like the heavy hitters that keep going to the nurse, keep going to the school counselor. You want to look for those types of, red flags. And then even after you provide all these additional supports, they're not learning. Does that make sense? Like they continue to be in the office. We do have some externalizing ones, but as far as behaviors where there's students. And let me just back up a minute, because it is a little different in each as they progress, correct? So in the elementary, their behaviors you'll start seeing more of the externalizing behaviors because they're littles. You'll see the hitting, the pushing, the crying and all those things. When you get to middle school, you kind of still see that a little bit, but you can also see the depression, the anxiety. I don't want to get out of this. I don't want to come to school. I don't want to get out of the classroom. I don't want to get out of my mom's car. I don't, those types of things. And then for high school, what we have pretty much are more of the internalizing, where they have a lot of depression, the anxiety, things like that. But I guess that's an overview. Of course, I'm generalizing, but for the most part, those are the type of students that we have. When they start becoming overly aggressive, then we will refer to a county program or a non-public program. Of course, after we've tried everything, such as a functional behavioral, some additional supports, ongoing IEP meetings, and all those things. Did that answer your question?
Yes, it absolutely did. Thank you very much.
Okay, you're
Thank
welcome.
you. Ms. Pope.
Hi. Thank you for the presentation. My question really has to do with like the teacher training around this. Obviously, we hear a lot about school safety situations, and I also really appreciate that you called out that not every student who has ED services is in special education and has an IEP or has a disability. I just wanted to ask, like, what kind of screening is going on at a really early age for emotional disturbance, and like how early is too early, or what are those first signs that we as a community can see and maybe change the path for someone's life by getting them services earlier? Is it the same kind of statistics on early intervention for mental health issues? Just curious.
Well, to be honest with you, like I said, we service from kindergarten all the way up to 12th grade. And so what we end up seeing in regards to, there's no formal screening that we have other than the school team acknowledging that the student has needs that need to be addressed, that can't necessarily be addressed in all general education settings without special education support. So just like with all students, whether it's they have a learning disability or autism or anything like that, it would definitely be coming from Child Find or a student, a counselor, a teacher, a parent, the admin, acknowledging that this student may need additional support. So it can come through with student support team meetings or SSTs, a parent request, a teacher in kindergarten or first grade noticing that the student needs additional supports. So when I say like the collaboration, and it's definitely it takes a village. It really does. What I found is a lot of our students, if they're demonstrating these types of behaviors or these types of concerns, for the most part, this teacher and or the counselor or the parent or admin is making everyone aware. And from there, we kind of go through the process for that.
And did I hear you correctly that there's a little bit of like a hesitation, or it has to be to a certain point before you introduce to behavioral health? And if so, is there a reason or any science behind that? I kind of feel like if we introduce it to behavioral health and they're getting that comprehensive care across the board, we might have a better chance at addressing mental health issues for their life. So what, as a school district, what is our responsibility to get them that care that's not just related to their education, but as like a whole human?
And so there's different ways of doing that. So if a student is not in special ed and a teacher or a counselor or someone like that wants to refer them over for outside community service, there are routes to do that through the STAR program and things like that. If the student has special education services, then we have two routes that we can go. One is through Empire, and that is a not as intensive service. In my mind, it's kind of like the same type of service, but it comes with a little bit more in regards to when we go into the ED program. So there is the route where we are looking at, let's see if we can provide special education counseling services through Empire, and then usually they'll determine that for a few months, and then they'll determine whether or not the student needs a higher level of support and then from there they can complete a referral while they're still receiving their counseling services through Empire. They can complete a referral to Ventura County Behavioral Health, and then from there they would complete an assessment and determine whether or not they would benefit from their services. Ventura County Behavioral Health through URSIS provides support for individual counseling, social work services, and if they're in ED programs, they also provide group counseling. So the individual counseling, there is no set limit in regards to the amount of time that they can recommend. It's all individualized. In regards to the social work services, that's the clinician collaborating with parents, with teachers, attending IEP meetings, coming into the classroom, just kind of observing. And then, of course, the group counseling is something that within the ED programs that they have once a week. And it just depends. It's usually one class period once a week, and it's the students in the ED program, and they go over whatever it is they need to go over as a group.
Thank you. I know I'm talking a lot here, but I'm just going to say one more thing. I think every parent on this call can relate to knowing that your child may have a disability or some differences about them and just kind of like ignoring it for a moment, maybe putting it off longer than we should. I think denial is a parent's natural state initially. And I can only imagine that with mental health, it's 10, 20, 100 times harder because you can ignore it. And I would love to see, the entire country, like the schools, really pick up a little bit more of that slack as society, because clearly there's a lot of shortfalls. So I think if VUSD could kind of pave the way and be like, this is our system and this is how we address from a very early age when we see that there are these more severe your mental health issues, or we know that there's a likelihood that there will be a little bit later on based on the data that we have. I just think it would be really great to be able to address those earlier and in the most proactive way possible. So thank you. I'm done. Thank you so much. I appreciate your.
You're welcome. You're welcome.
Thank you, Ashley. Those are great questions. Is there any other questions for Ms. McCarroll at this point? Okay, Katie. Well, thank you for presenting about emotional disturbance. And at this time, we can move on to Stacia Helmer for the moderate severe. Stacia, do you have the slideshow?
I am
Okay.
able to share my slideshow.
Oh, there we go.
Okay, welcome everybody. So the moderate to severe special education program at Ventura Unified services kids with the most significant disabilities as part of the federal guidance. It's typically the 1% of the population. The requirements also require a need in the area of adaptive behavior, and that means that they have needs in life skills, pre-vocational skills, being ready for adult life or life independently. Students that have those significant disabilities and adaptive behavior needs, as well as the need for different significant supports, and those are possibly like speech and OT or life skills, things like that are the 3 areas that we're looking at. Those students who have those 3 criteria are put into a track that has alternate testing, the California alternate testing, the CA testing, and then all the alternate LPAC for those students who need English language support and testing. And those students are put into a curriculum that is a modified curriculum. It is based on the Common Core Connector standards, which are those essential standards within the general ed standards. And a lot of districts, including Ventura Unified, use the unique learning systems as a curriculum that supports those Common Core connectors and the modified curriculum, which allows the students to work up in different levels based on those standards, but at a modified level. We also work on life skills curriculum that addresses those adaptive behavior needs. And then once a student is found to have those supported needs in elementary school and middle school, by the time they get to high school, they're on a track for getting a certificate of completion instead of a diploma. So that means in high school, they're not having those requirements to graduate. And students that receive a certificate of completion at the end of high school do qualify for a post-secondary program, which is a program that supports those academic and those life skill needs for 18 until the semester or that they turn 22 years old. Currently, we have a program for students with more moderate needs, and those have been historically in the district for quite a while. We have 4 classes at Elmhurst, and they're kind of broken up in grade levels, pre-K or a TK, K1 maybe, a 2, 3 possibly, a 3, 4, a 4, 5, depending on numbers. And we have 2 classrooms at Data Middle School, which are typically the students stay in there for their entire, with the teacher for their entire middle school career. And then we have 3 classrooms at Buena as well. And those students typically stay with the same teacher for their 4 years of high school. We also have our newer program that we took back from the Ventura County Office of Education 2 years ago. And these are programs for students with more significant support needs that were currently are in elementary school with the county at Penfield School. And those students are now coming onto our comprehensive campuses, which they were previously, but it was run by Ventura County Office of Education. Now we are serving them through the district. So we have 3 classrooms at Balboa Middle School and 2 classrooms currently at Ventura High School. So how does our curriculum work? The Unique Learning System curriculum is, as I said, a modified curriculum that is used for the students with the most significant disabilities and those adaptive behavior needs. The curriculum is aligned to those Common Core connector standards, which are the most essential standards within all of the general ed standards. The curriculum also has differentiation at 3 levels for each grade band. And those are the level 1, which have the more supported needs. There might be more participation type of activities rather than the more of the academic needs. It's the same curriculum, it's just their way of responding is at a different level. And that errorless learning can occur for those students who are level 1. So there's level 1, which is more of an experiential errorless learning. And then there's level 2 that has more moderate academic rigor. And then there's the level 3 that is the more rigorous. The grade bands, there is a pre-K grade band that we're not currently using. We have the K2 grade band for the lower elementary, the 3-5 for the upper elementary. There's a middle school grade band, a high school grade band, and then a transition grade band for those students in that post-secondary program. We also, part of the Unique Learning System has that functional skills curriculum built into it. And then we do supplement that to work on the adaptive behavior. So those might be those self-help, independent living goals. Once they get to middle school, high school, they might be working through more pre-vocational training and community-based instruction where they're actually learning out in the community, learning how to ride the bus, grocery shopping, being a part of their community. So that's all I have for my presentation. Is there any questions?
Yeah, Stacia, can you, similar to how Katie answered, what's the process look like if we have a student that comes in the district that has these types of needs? If you can kind of go over what some of these needs may be and what the process is to potentially look at a program at this level for children.
Sure. Typically, students in the moderate to severe range have a developmental delay that is found very early on. Typically, they have a cognitive level that is in the intellectual disability level, but on occasion we'll reassess students at the elementary level or middle school level that we find that they have more of those significant cognitive needs. So we're looking at, as I said, those cognitive needs, those adaptive behaviors. So typically when they're being assessed, they'll be assessed for the cognitive, they'll be assessed for those adaptive behavior needs, which parents will get ratings and teachers will get rating scales for, and we'll see what those needs are for their life skills needs. And then what supports do they need? Do they need a smaller class size? Do they need more interventions? Do they need that modified curriculum? Are they able to participate in the the general state testing or not? Do they need that really supported testing environment, which is a one-on-one and very picture supported, all those accommodations in the testing? So we look at a bunch of different things. So if an IEP comes to me from outside of the district, I'll be looking at those things. Do they have those alternate testing, alternate curriculum needs? Do they have supports from Tri-Counties Regional Center? The majority of our students have been assessed either through Tri-Counties or through a doctor in the past with some significant needs. And then we look at, are they able to be successful with the regular curriculum and the regular state testing, or do they need a more supportive environment? Once we get those needs in there, the IEP, then for our district, we're looking at, are they able to work within our moderate program? Or do they have more significant needs? And those would be typically those students who would be referred to our county programs that we're now servicing at the middle school or high school level.
Thank you. I appreciate that answer, Stacia. I know it's we have a lot of programs in this district, and that's why we have you guys come on and share this information. We do have a couple questions. We'll have
one thing before it's just the moderate to severe and the alternate testing and the alternate curriculum have more of a federal mandate. So this is something that has come down from the federal government that we need to look at. So there are specifications in that and what are the requirements to be in the alternate testing and the alternate curriculum.
Thank you. A few questions here. We'll start with Ms. Pope, then go to Ms. White, then go to Ms. Reyes.
I have two quick questions. The first one is, what is the status, or is there any plans for a mod to severe K-8 option?
Oh, at one of the K-8 schools? Is that what you're talking about?
Yeah.
We have not discussed that at this point.
Okay. And then my second question is around inclusion. I know that there's like a percentage, I think it's like 30% that all mod severe have inclusion. Is that correct? Or is there a percentage of time that they spend with the general population?
There is no, it is all an IEP team decision. The minimum amount would be typically for breaks, lunch, passing periods, and school-wide events. So, when you're calculating out that for different school sites, it's completely different, but that's typically anywhere from about 20%. So that's typically the minimum percentage that students would have. And then an IEP team decision based upon need or what the kids would benefit from. And we have students that, go all the way to 70% or more, depending on the IEP team.
Yeah, I just wanted to point that out. I know if any parents are listening, they might be thinking like, oh, I don't want my child to only have like experience with these 5 kids in this classroom. And I know that there are a lot of integration opportunities, both at 20% and then additional available with your IEP teams. Thank you so much.
Yeah.
All right, Ms. White.
I just had a question regarding the kids that may academically, be in not the mod to severe program, like the mild to moderate, and are able to academically do that, but need the support of like a moderate to severe program. Is there any in between as far as like, are we ever going to have a program for kids that academically are strong, but are put on the unique program because they need more support as far as that? I don't know if that makes sense, but.
Well, typically, if you're looking at a student, well, like I said, that's in the mod severe program, they should be they should be that lower 1% of the population, and they should be having those adaptive behavior needs, need to be on alternate testing, alternate curriculum. Occasionally, you'll have those kids that are in between, and we need to find programs that kind of support both. But under the federal guidelines, we're pretty clear on who those students should be that are on that alternate curriculum. And if they have an intellectual disability, and if they have adaptive behavior needs, and if they need significant supports. If there are a few kids that have those splinter skills, I would say that they're higher level, maybe in a reading or in certain little areas that they need extra support in. We do have supplemental curriculum that we use to support students. It's not our board approved district curriculum, which is the unique learning system, but we do have supplemental curriculum that we use for reading, or we can use different gen ed curriculum or different curriculum that the Mild Mod uses. And we have sites all over the district that are using supplemental curriculum based upon the students' individual needs.
Okay, thank you for that question and that answer. I believe we have Ms. Reyes, and then we'll have Ms. Herrera after that.
Hi, I was just wondering if you could kind of go through what the post-secondary program looks like, or what.
Sure. So for students that are on our alternate testing and alternate curriculum and receive a certificate of completion, not a diploma, those students are eligible for the post-secondary program. We do not have one of those at Ventura Unified as of yet. So those are referred out, those students are referred out to Ventura County Office of Education. And currently that program is at Boswell School, which is over by Ventura College. And what a post-secondary program looks like is they're working on a functional skill, more of a functional skills program. So they'll be doing functional academics to prepare them for adult life. So a lot of like use of money or time or reading signs around the community, or things, reading a bus schedule, writing a resume, getting them ready for life out in the community. So the integration into the community is really important for these kids. So they'll be getting out to do community-based instruction, which could look like learning how to read a bus schedule, learning how to take the city bus, learning how to get to shopping, learning how to read a recipe, make a shopping list, go grocery shopping, come back and prepare the meal. There's a lot of safety awareness in the community that's taught, and then a vocational training as well. So the students in the school setting might be learning how to do some simple jobs in a structured setting. And then once they're ready to go out, they have job sites around Ventura that they'll go to and set tables at a restaurant, or help create boxes for the pizza place, or go to the animal shelter and help take care of animals. So part of all special education students, once they turn 16, they have a transition plan. And during that transition plan, we have to look at what their skill set is, what they're able to do some assessments on that, and then what their interest is. So those are two assessments that we're required to do for that transition IEP. And from there, that's kind of where we determine and then there's the course of study on the IEP when they turn that age. So then we determine what is their course of study for high school and for post-secondary to meet those needs of what are their skills that they need to work on, what are their interests, and trying to blend those together to create a course of study that will help them get to that point by the time they're 22, that they can be as able as they are be functioning in society with the supports that are needed. Just to let you know also is once they finish from at the 22-year-old age, if they are Tri-Counties Regional Center clients, that's when Tri-Counties will pop in and be really, really important. So if we have any families here that don't feel that Tri-Counties is important for them and they're not utilizing them, I really recommend keeping that connection with them, because once they turn 22, all the services are provided through Tri-Counties. So if you need respite services or adult day programs or job coaching or helping to teach them to navigate the community, all those support services and agency support services are usually through Tri-Counties. So it's really important later on to make sure their connection is there.
Thank you for that question and that response. Is there, yeah, we'll move on to Ms. Herrera unless there was a follow-up question to that. Okay, go to Ms. Herrera and then Dr. Dreher. You are muted, Dora.
Sorry. Hi. I have a few questions. See, where do I made some notes. So, like for the high school, you were saying that the transition meeting starts when they're about 16. I've asked for a while. I have incoming freshmen this next year. Why is it that we have to wait until they're 16 if we're pushing for every, I think, disability? They want like the earliest type of intervention, right? So if we know that our kiddos are going to need a lot more support and a lot more help, why not start something like that, like in middle school? Like, for example, like he goes to data. Right now, they're having a computer programming classes for like the gen ed population for something like that. I know that Buena has a career center, like those tech jobs that they just started this year. And I remember that I asked, like, how can a student from like the program, special ed program, participate in that? You know, and make something that accommodate like what their not just their needs, but what they would be successful at, right? So, for example, if they have, and I don't know what they have, right? But if they have like a class that they could put together, like a computer, right? Would that be something that's available to them, or can they bring it down so at the level where they would be able to understand, right? Because I feel like waiting until they're 16 is a little too late, because the jobs that you were talking about, I feel like those are really low expectations for them just to be making pizza boxes or for them just to be setting tables at a restaurant. Just because the kiddos in that program doesn't mean that they're not able or capable to be able to do something on a larger scale, but maybe that their behaviors or their needs or their, in my case, like his STEM may not allow him to work, for example, at a library because he can't be quiet, but maybe he could work somewhere different, right? So if we're setting up our kids with, in my opinion, those are like super low expectations because all the kids are not the same, right? The needs for my kiddo is going to be different from the needs of the other kids. And it feels from what our journey has been, it's just been like, stop the behavior, stop the behavior, stop the behavior. But what about those kids that like don't have so many behaviors, but that they're able to do more? So we're just kind of like waiting in the trenches, right, to see what's going to happen. And then now I'm just learning that is when they're 16, we're going to talk about him possibly being trained like for a job. Hold on, I'm not done. So then that's
can I answer that first so I don't get off track? So basically, when you're in elementary school, those sections on the present levels IEP are there. So the elementary school teachers are already starting to think about that. What are the independent needs? And it might be, you know, learning how to wash your hands or learning how to cross the street safely or something at a younger age, how to brush your hair or whatever it is, you know, those life skill needs, how to stand in line in an elementary school. Are those pre-vocational things that they're working on, and they're on the present levels? Those boxes are there for elementary. So the elementary teachers are thinking of how to set the kids up at a younger age. Also in middle school as well, you know, they're working on what are the things that we can work on that is going to help the student in their future life. we can do those transition plans earlier, but we are required to do it before the IEP of their 16th birthday. Some people choose to do it earlier. Some districts choose to do it earlier. But as a general overall, that is the requirement to do it in the IEP. So usually it's their freshman year in high school that we're talking about actually pre-vocational, not all those small steps to get them ready and set up, which should be talked about starting in kindergarten. But to really look at what those pre-vocational skills sets and interests need to be done at that, and the assessments that we have to do it. So we have assessments that we are required to do at that time too, which are not assessments that work for younger kids. You know what I mean? They're really driven on that. So did I answer? And then as far as that planning of the course of study, so those assessments that we have is kind of what helps drive that. It might be interviews with the families. It might be interviews with the students. It might be actual like assessments, like what are you interested in? What out of a field of jobs, or do you prefer to work inside or outside, or you know what do they enjoy doing? As far as you saying limiting jobs, no, the kids in these programs have all types of jobs. I just threw a couple off the top of my head. There's students in the post-secondary program who have been working towards getting a driver's license and have actually get a driver's license, and they're working on that. There's students in the post-secondary program who learn to take the bus independently and go to a job site independently, whatever that job site is of their interest. I've had students that have been working in the film industry and been making movies because that's their real interest. So I just threw out a few jobs, but it really depends on the ability level of the kid, what they're interested in, and you know what they want to pursue. Also, there's the Ventura College program that's available that is not a credit program that can help the pre-skills for students at that age. And there's a program called, if you can see, it's called the ICANN program. And that's a program that can help teach students workplace skills, job seeking skills, occupational safety, keyboarding, math, budgeting, all those kind of things to help them also. So that's another thing that our students at that 18 to 22-year-old range can work on. So I don't think that there's a limiting of it. It depends on the kids' needs and looking at them individually. Dora, now you have more.
Yeah, no, I do have more. It's just that I feel, and it's just my opinion, that it needs to be like per student. I've always felt that our kids are kind of put in a box, right? And then this is what you're able to do. I mean, you should have mentioned all of that, right? And not just focus on like the small tasks. And not that they're small tasks, somebody has to do them, but we should be encouraged as parents to really think that our child could do the best that they can do. And if we're sitting at these meetings and like trying to figure out what's going on and ask, if we don't ask the right questions, we're not going to get the answers that we need, right?
It's
like
all
I've been told, yeah, and that's what they always say. So like, for example, like for the classes that we want him to go, if we wanted him to take like, I don't know, like a computer coding class, you know, he can't because there's not a paraeducator available. That's my whole point, that it needs to be, if you're going to say that it's available and that it's there for the kids, especially in middle school and high school, then it really, 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 really needs to be available for the kids, yes. You know, if they need that assistance, right? So that's all I'm saying, because it is very much, if we're not banging on a door, it's been my experience, if you're not banging on a door asking the right questions, the uncomfortable questions, you don't get the answers. You just sit in an IEP and they just tell you, well, you know, like children with autism, will, adults with autism will. And it's just like, well, no, we're not talking about a person with autism, for example. We're talking about the individual, right? And so that's just,
Yes.
it's a scary thing as a parent, especially when you're transitioning and all of a sudden they're in high school and then all of a sudden they're going to go. It's like, well, what is he going to do? And why do we have to wait until, I thought he had to wait till post-secondary. Now you're saying 16. That's a little better, but it should have been something that's starting a lot sooner, in my opinion. And depending on the kid, right? Every kid is different. There should be a program, I think, I think Jenna said that it's kind of like a medium program, right? That is not mild to severe, that is not mild to moderate. That's like for these kids right here. And there's like nothing for these kids. So our kids are like, well, I think he'll be successful here. No, I think they'll be successful here. And that's not fair for these medium kids, I feel. So I think that's something that we really, really, as a district, need to focus on or create. And you guys could create that and it would be wonderful. But that's just my opinion and that's it.
Currently, the way that our everything is set up, including our alternate curriculum requirements and our credentialing requirements, it gets a little bit tricky because we do have credentialing requirements. Those credentialing requirements are going to change. They're going to be based more upon those supports in the future that are needed. So we're going to be looking at students and their needs regarding supports, and that credentialing is changing starting in another year or so. So it's going to be just interesting how that's going to look at when we're looking at what are the level of supports that students need, not that they fit within these credentialing areas. So that's just going to be an interesting change. But right now we are a little bit confined to, are they on alternate curriculum, alternate testing, and the credentialing of that teacher that's credentialed to teach that.
Okay. Thank you. And of course, we will continue to look into everything you guys are providing. Thank you, Ms. Herrera, for providing that information. Let's move to Dr. Dreher and then Ms. Laylam and then Ms. Hinonosa. There we go. So we'll do that. And then after that, we will move on to committee updates. And I might sneeze, so sorry, I'm going to mute myself.
Thank you. And thanks for this discussion. I think this brings a lot of stuff to light. And I will say, although that my particular child is not in a moderate to severe program, he also does not fit in any box that the district really has. So do I really relate to kind of the other parents who have these situations where their child just doesn't fit into standard box? I'm actually kind of speaking more on personal terms with my own personal experiences with the moderate to severe program with one of my younger sisters. And granted, she was in school a long time ago. And I brought this up before, but so she was in this 1%. She does have intellectual disabilities. And the district that she was in offered an integration program that I've brought up before. And I just feel like this is the right place to bring it up again, although it won't apply to us. But I think that it's a really wonderful program where she was buddied up with a mainstream gen ed student for elective courses in high school. And so she had a buddy who would come and pull her out of her class, and then they would go do whatever the elective she was signed up for that, semester or year, depending on what it was. And that really offered, despite her intellectual difficulty, she's quite the social butterfly. So for her individual, it was really great. And there was a reciprocal component from the gen ed curriculum, because all these kids go out into the world, right? Hopefully they all have some kind of job or function within the community. And there needs to also be that acceptance of like the people that are going to be working with them, or maybe they're not, it's an employer at some point down the road. Right. And so I think although the way all these programs are set up for very appropriate reasons to have, individual classes, that getting that integration beyond recess and lunch or passing each other in between is really getting them involved. that it's a two-way street. And so I just want to throw it out there. I know we don't have anything really set up like that.
We do.
We do have something set up.
Yes. So let me share with you a little bit. At Buena High School, for instance, all the students in our moderate program all participate in 2 periods of general ed. They all go to a general ed PE and an elective. And then their BARC period, which is their intervention period, they're participating in that BARC period as well. We have the unified sports program that's really going well at Buena too for our moderate kids. And the teachers provide their BARC period where they invite the general ed students in there too. And then I actually got this set up for the whole county that they participate in sports activities with other high schools throughout the county. So Buena has a lot of those programs already set up. And, you know, some of the students, I think the average students, I can't give you the percentage, but their percentage of integration into general ed is pretty large. And all the students in our Mod Severe program at Buena participate in all of that, unless for some reason that they can't or don't want to, you know. So yeah, we have some really great things set up. And we also have peer tutoring and buddying programs. We have clubs, the unified club set up. So there's a lot of buddying programs set up and clubs set up. And Buena in particular is doing a really great job at the high school level, because you were talking about that high school level.
Yeah, thank you. Yeah, I thought that up before. No one had provided information that there was already some type of program. Is there plans to have it also at like the middle school level, or is there one already at a middle school level?
We were really trying to set up this unified program also at the middle schools and the elementary schools right before COVID, because I just started in this job like right before COVID. So we had we were having committee meetings and we were trying to get things started, and then everything shut down. So yeah, that's something on the agenda to get going again too. And I know the middle school here at Balboa and the high school at Ventura High with our more significant students is starting to get that reverse integration going, and they're getting those peer tutors coming in where the general ed students will get an elective credit for being you know how they are office aide or something, that they'll be a peer tutor in the classroom. So we're really trying to get that peer tutoring program going, these clubs going, and then the sports programs going, and then more students integrated into PE and electives for sure.
That's really great. I'm really happy to hear that. Like I said, I'm not sure that my kids in elementary school, so I don't really know what the future holds, but I think just in general for special education, I think that those programs are really, really, really important. And, you know, the vocational stuff is important. And I want to echo, it's super, super individualized, but I think just feeling more like a general ed student and having those social skills is just important. It's like learning to ride the bus. I mean, from someone who's walked this path with my sister her whole life, she does not take the bus. She doesn't. I mean, there's no way she could ever take the bus, but she certainly knows how to navigate a store pretty well, you know? So you just have to, you know, just as saying this to the other parents, you really just have to fight and bang down the doors for what you think your kid will need and be successful for, because there just isn't a box to put anyone in, where every kid is different. So thank you for your explanation. I really appreciate it. So
we do need, we have three, we can go with the Leslie, Melissa, then Laura, and then we probably should move on because we do have a few more items we need to cover. And obviously if we have some open time later, because we have to be done by 11, we can discuss more. So let's move on with Leslie.
Good morning, everyone. I am really glad these questions were asked because being that my son is in his second year in middle school, it's nice to know what type of options, first of all, that they're starting to have the tutors coming in. That's so important. And I want to echo what Dora said, because it really does need to be done a little bit sooner. My son at the school, I know, and I mentioned this to some of the leadership there, is that when the emails are going out saying, it's time for everybody to pick their electives. And I think I actually had this conversation with the school in 6th grade. But there's this big discussion and this big excitement of let's talk to the school about electives. And my first question was, oh my goodness, how exciting. My son is finally, it's time for him to get electives. I remember when I took electives, and the question was, what electives are available for his special ed classroom for the autism program? And he's in that classroom. It's more of working on his study skill. It's a study skills program, and I get that all of that is important, but my comment was his grades are well. He's got honor. I mean, if he's doing really well in that, why isn't there an elective option for the special ed program in the middle school setting? How exciting would that be? I can tell you that, extracurricular outside of school, he's so interested in so many things. I thought, oh my goodness, is there language? Is there, what type of, it was exciting to me, and I know it would be exciting to him, but that it wasn't available. Now it was told to me that he can integrate with, he can join another, a general ed elective, and we'd have to see if there's a paraeducator available to go with him. But I feel like his entire classroom would benefit from that. Why can't, and I asked the school counselor, and she said, that's a great idea. Why can't an elective program be brought into their classroom? Why can't, we have speakers, we have people who come in. Why can't the woodworking, if it's wood shop, why can't wood shop come to them on their level? And these are just, we want to have, like Dora said, higher expectations from our children. There's nothing wrong with working in retail. There's nothing wrong with working in a grocery store or a pizza place, nothing like that. But if I see so much potential, why can't we start tapping into that at an earlier age? And I just really do think it needs to start happening in middle school, because that is when their minds are just changing so much. And there's just so much opportunity there that I think is being missed.
So that's a really interesting concept that just came up at a meeting that I had this morning, is instead of, some students have a more of a difficult time going out into a general ed class, is that we're discussing in some of my programs, the principals actually are on board with it in some of the classes too, of bringing a general ed teacher into the special education classroom to provide electives in there, if that works out easier for the students than the other way around, and bringing general ed students, maybe a small amount, into the special ed class to provide that support if it's too difficult for the students to make it into the general ed. So just knowing my background, everybody, I've had a background working with kids from preschool to post-secondary and all levels of inclusion, from a full inclusion program, partial inclusion programs. So I know how all the inclusion programs work. And if you ever want to talk to me about it and really what your vision is for your students, I feel like I could help facilitate that at the different sites. All of our sites kind of do something different based upon the interest of the teachers or the motivation to get things going, so each site is different. But if there's some areas of need that need to be worked on at different sites and there's interest, then, I can help facilitate that as well.
Well, I would absolutely appreciate that. I think it's just so important.
Yeah,
in a middle school level to bring more opportunities.
We do have our autism, or one of our other program specialists, coming on next SEDAC, just so you know. And I understand there's a limited number of periods, and we're working on the elective things. I understand that question, and we'll also be we can address it also at the next SEDAC meeting. But again, the goal for all of these programs is to provide as much inclusion as we can. We want to prepare our students to be adults and have the ability to function not just within our educational system, but outside of our educational system. I know it's a huge passion for our board, for our superintendent, for our assistant suits, for Marcus Conant. It's a big thing, and we will be actually having somebody come on to talk about our transitional support also in a couple SEDAC meetings from now, hopefully, to kind of look at that information for everybody here, because we do think it's very important.
Just one more comment. Sorry to interrupt.
Go ahead.
One more comment before you said that, and I'm glad you're saying all that. It's exciting, and I think it's important. I think we're going to get so much more out of our high school kids if we start earlier. The last thing is I want to mention, you talked about inclusion, and I can tell you that to hear you say, inclusion is happening on breaks, on lunches, and on PE. Currently, right now, the inclusion that my son has is on breaks, lunches, and PE. But breaks and lunches is, their classrooms are located in a separated kind of, I don't want to say the word segregated, but maybe separated sounds a little nicer, but a separated area of the school. And so there really isn't, I asked my son yesterday, do you ever go and get hot lunch? Would you like to get hot lunch? Would you like to go and purchase rather than being safe and me sending with you? But I don't know if he's going to know what to do. I don't know if how often is that happening to where they sit in their lunch tables together. So they're only in their little group. And so they have breaks together, they have lunches together. They're not even close to where everybody else sits at lunchtime. They don't get that interaction at all, unless they want to go purchase hot lunch. So that's one. And the other is at PE, yes, he does get, I am grateful for PE because he does get exposure there, but that is the only exposure that he gets with inclusion. That's it.
So we have, and again, I understand that campus really well. Yeah, we'll look into that, and I'll talk to our other program specialists too. The goal is that, and we don't limit them, they can sit wherever they'd like. And obviously a lot of times they like to sit together. But the goal is, okay, we start, as Stacia was saying, we start with PE and lunch and break. But the goal for any student is, okay, what's the next step, right? Mm-hmm. What's the, maybe we can push them into another, if there is an available elective, or maybe a not as heavy, maybe like a social studies class or a science class. So the goal is to do that. And a lot of times when we have kids coming in as sixth graders, like at Balboa, for example, they'll start with more services. And as they progress through the grades, we're able to start pushing them more and more into those general education settings. If they can access it sooner, we obviously will do that too. So we're always trying to be very sensitive to that and not have them, again, the goal is to get them more and more into the gen ed. And sorry, we do need to move on. So I'm going to have Ms. Reyes provide. I know that you had a question also.
You know what? I'm going to be really quick because Leslie said exactly what I was going to say about the electives and started that whole thing. So I'm good there. But I will say that I know at Ventura High School, the football players, my significant other is a football coach. And the football players go and they eat lunch with the special education students every day. And I'm pretty sure Buena's probably doing the same thing. They go over to my other son's school up at Poinsettia and they read to them. So lots of little things happening. And that's all I'll say today.
Yeah, and they participate in the unified sports with them as well, all the athletes, and it's awesome. Yeah. Thank you for sharing a positive.
Yeah, thank you. So yeah, we'll continue to push those. Finding some ways to have them more integrated even during lunch and recess, as you say. And some do it, but a lot of them like to, from that program, like to sit together. So that is something we do need to continue to look at, Leslie.
Thank you.
Go ahead.
Everybody.
Sorry,
Go ahead,
I just
Leslie.
want to say, I encourage my son to, he doesn't have an option. I tell him, you need to see what other people do. When it comes to PE, he says he wants to just play with one friend. I said, that's great. You have but you need everyone, but once you do what everyone else is doing, you have to do it. I'm going to ask your PE teacher. And so he knows that. And it's something that it helps him build strength and confidence in okay, I need to go and do this. I need to be a part of what other people are doing. So I do not let him stay in his little bubble. I encourage him to move out. Yeah.
Well, thank you again for that input. I really really appreciate it as everybody else's input. Now, thank you, Ms. Helmer, for coming on today.
Thank you.
So
Thanks so much.
you can stay on or take off. I know you don't
I
have
have a
anything
meeting.
else going on
No.
with the program, so it's
I
up to
gotta
you.
run.
Okay, well,
All
thank
right,
you.
take care.
Have a good day.
Bye-bye.
Okay. Okay, so we are going to move on to committee reports, and I want to provide a kind of a bigger update because, again, when I was doing the individual meet and greets with, and we're still doing a few with the principals and the SEDAC reps, one of the biggest areas was communication on how you are able to communicate with other parents on the site that may have questions, may have students within our programs. So I do have an update on that. So Marcus Conant has sent out a survey, and now that we've made headway connecting our site reps with our principals, as I said, we are working to execute the next step. So recently, our site reps should have received the short questionnaire. And if you haven't received that, please let me know. And this is for the committee and the community as we are live. So I want to make sure everybody knows what's going on. And we're asking our reps to identify and provide us with a dedicated email address where their school site community members can contact them. And once everyone has provided us with their selected email address, we will send out this contact information to our community using our Parent Square platform. And we will also use this platform to let our community members know what school site each of you represent and provide an email address for so they can contact you. And we will also post this information on the SEDAC portion of our website, and site reps will be asked to list the contact info in their Zoom screen names during SEDAC meetings to ensure multiple meetings of providing access to our community members. So going forward, when you come on the screen, it's going to be great if you can also put your email address so that we want to provide as much access as we can. As you are the reps for the schools, you're very knowledgeable in what's going on around the district and at your sites. So we want to be able to provide that information to everybody else. And again, if you have not received that questionnaire, let us know. So is there any comments about the communication piece?
I have a question
Yes.
regarding communication. Is Marcus still going to be like the lead of this meeting, or are you the new lead of this meeting? I feel like that wasn't communicated.
Oh,
I know I'm
yeah.
pulling at branches here.
It kind of depends. It can be me or him. Again, regardless if it's me or him. If it's me, he sees all the communication. We take notes on this. We have the recording. He goes back and watches it. So even if he's not on here right now, the goal is to make sure that we answer all of your questions. So it could be either him or me, Ashley, or both. So he may be on the next one, but maybe not all of them.
Okay. I also, just in terms of what SEDAC was, I know that we started it right before COVID, but it was kind of presented as like it was our place to come and talk to the district. Like, yes, there was definitely a learning component, but I believe that this is maybe the first time in 5 months that we have an opportunity to give site feedback today. And I just worry that by going through these committee reports, we're going to miss opportunity. And then also I noticed that a lot of the programs that have been coming up lately are actually repeated. And most of us have seen them already, even though we've asked for programs such as like para-educator training. And there's been a lot of feedback on things that we want to hear about. But now we're getting to just a repeat of a cycle of things that we've already heard. Not that it's not useful. It's just I think there is a better way to use our time. So I would ask that maybe you look at restructuring the meeting so that we give our feedback first, and then we move into a presentation. I don't know if everybody else feels the same way, but I know we set aside these 2 hours to see change, and it sounds like a lot of this commentary is the same commentary that we had at the beginning when we started SEDAC almost 3 years ago. Thank you.
Yeah, so a few things there. One of the things is so the para situation, we have all that information that you provided us at last meeting. We don't want to rush that information that we're going to provide. So we did take that input, and we are looking into one of these future meetings to discuss a lot of that information. On another note, though, as far as like having the presentations, yes, you guys are the representations for the schools, but it's not only you that is receiving this information. So although you are the reps, we do have a lot of This is on YouTube. We have, committee members. Aside from committee members, we have other parents and adults that like to know this information. So that's why we're providing it. And I do think it has created a lot of great discussion. We've had really good discussions today about the two programs that we have had.
Yeah, I'm not saying it's not valuable. It's You guys brought us together and bring us together each month to tell you what we want to learn about. And we've given feedback on several different topics, as well as feedback, like going back to my K-8 question for mod severe program, to hear that wasn't any type of a conversation with the program coordinator. I could trace that back to probably a year ago. So it feels sometimes like the communication that we're even putting out in this committee isn't being as received as maybe it could be. And everyone else, please feel free to tell me to hush if I'm the only one who feels this.
No, I think that's great input, Ashley. I think that's great input. And I do think there is time on these meetings. For example, we talked about paraeducators for probably 45 minutes last week, with your input. So we do want to, there is the training piece, but there's also a piece where we do, through these updates, provide you a platform to discuss what's going on at your site levels.
Yes, as long as we get that opportunity, which
sure.
Last time we did not because we ran out. And then this time there was 2 programs to speak about instead of 1. So with that, we can move on. That was my take on communication. It's hard for us to communicate back to our school when they're telling us what they want us to present to you at these meetings, and then we don't have the opportunity to do so. That communication is already severed.
Well, and again, thank you for that input. We do want to make sure that your voices are heard. Ms. Herrera?
Sorry, I agree with Ashley. Ashley's just so much better speaker than me. But no, I agree with her. I know that we were supposed to get more, training classes. Like I remember we were talking about the that college program before and all that. And I get it. I think it's good, like you said, for a new audience to hear this information again. It is kind of a bummer when they come and they tell you the same thing and then you're asking the same question and they tell you again, oh, we're looking into it. It feels like that's the cycle of a special ed parent. But I agree with her as well. She just says it's so much better than I would. I have no idea.
But we do, and keep in mind, we do have new SEDAC reps also that are new to this committee. So I know some of you are vets and you may have heard a lot of this information, but even our programs are changing quickly also. So I understand there's a balance there, and we do want to make sure that you have a lot of opportunity to share your input as well. So when we go through these committee updates, this is where you do have the opportunity to talk about it. And that's why I'm glad that Ashley and you, Dora, have shared that information about the communication piece. So thank you there. So the next thing is we do have, there was a quick question. I know one of our SEDAC reps emailed our department about the mask updates. I want to say this comment, just so you guys know that that's not a specific to special education. So we don't have any additional info to share beyond what was shared at the most recent board meeting. And then obviously our district sends out updates whenever we receive new direction. So I just wanted to give you that information there. The next thing, though, I'd like to have is our SELPA CAC representative report. So, you know what? If we can go over that briefly, then our PAC, and then go ahead.
Can I just make a comment or ask you a question about what you were just talking about?
Yes.
As far as the mask mandates, and they're constantly changing, right? I understand that you're not the representative across the district for the mask mandates, et cetera, but you are at the higher level of your department. And I just want to request that our kids are being spoken for, because some of our kids are much more vulnerable than other kids. And that is an issue for a lot of our families. when our kids are more vulnerable, some of them immunocompromised, et cetera, and we'd like them to be in school, but we'd like them to be safely in school. So it does affect us in a different way.
It totally does. It totally affects you in a different way, and I fully understand that. And I know every family member and family have different situations. So I don't want to make it seem like we don't want to discuss it. It's just the fact that there was information provided at the board meeting about it, and I don't have additional information, I guess, to share about the current mask mandate.
No, that's not what I was asking. I'm just saying when you're in your executive meetings, that we're counting on you to represent us in that respect.
Oh, okay. I understand what you're saying. Okay. Yep. Thank you. Thank you for that input. Okay. That I understand what you're saying now.
Yeah. Thank you.
Yeah. Can you provide me? Go ahead.
Sorry. I'll jump in on that one. I think it's really helpful to hear those parent perspectives. And I will just say, like, as a board member, I do get a lot of requests from families to say, my kid is tired of wearing a mask. It's, they're done with it. So I think it's really important for you to share that perspective. I occasionally get emails from families who say the mask mandate is really important for keeping my kids safe or for keeping my family members safe. And not that this is a war of who sends the most emails, right? Because a lot of this decision is not in our hands. But I do think that sharing that narrative of what your family is experiencing is very powerful for people, because I don't think enough people hear that to understand that these things are important for keeping, our kids and our staff safe. Who might be experiencing different issues. One of my nieces is doing chemo right now. And, for her, we all continue to wear a mask even when we aren't required, because it's what we're doing to keep her safe. And so I think if people share that, it's helpful. So thank you.
Thank you.
Thank you, Ms. Rodriguez. Appreciate that input. Since we have you, Cam, here, can you give us a CAC update? Do you have anything to share?
We haven't, since we spoke last, we haven't had a meeting, so no.
Okay.
Thank you.
Dr. Dreher, do you have anything for PAC?
We had a PAC meeting the beginning of February. Really, since time is of the essence here, there really wasn't that much that's specific to SEDAC. We got, another update from Dr. Rice about masks and COVID and, anything that really was pertinent. And Laura, please correct me if I'm wrong, but it's already been released and announced at this point because it was several weeks ago. There was mention about the cost of living allowance was going up, which is great, but it's really like a very little amount of money. So it's not really going to be significant to the district, was kind of my take on it. There's still discussion about the general obligation bond that might be going to the voters, but it was still going to be discussed at board meetings. Dr. Castro talked about what the teachers did on the in-service day. That was at the end of January. And we were given some links to the websites of the group that hosted it about, raising resilient kids and trauma. It was a whole set of websites, and I've actually visited a lot of them myself, and those were really fantastic. Again, not special ed specific, and supposedly those are going to be compiled and be sent out through Parent Square, although that hasn't happened, but that was discussed at the meeting. And then it was just the update on the websites now for the district are maybe at the end of March. And I think that was really the quick summary. Did I miss anything of importance, Laura?
I think just the fact that they're going to try to put the app up, that kind of represents like a link tree kind of deal to make it real easy for parents to get the app on their phone, which would get them to the website, which would get them to the exact icon, drop down menu they needed. So
yeah,
a lot of fluidity on the communications. And then just to use the ride share technology, because we have bus riders, and this is for all the kids, not just IEP special education kids. There's a really great app out there that tracks your bus. It's called Ride 360. So just that. And then, yeah, just talking about the elimination of the personal belief right, which I don't want to start a whole thing, but, you know, we're watching that closely. That's about it.
Thank you. Yeah.
Thank you.
The app is like in the works down the road, but I think every parent that was on there was like a big proponent of basically having one app for all of this. You would open it, it would have like Parent Square, Peach Star, your Ride 360, anything that was related to the school district would all be in one centralized location, and you wouldn't have to like remember 15 more passwords and stuff than we already have to do as it is. So,
Got it.
but that's like way down the road, I guess.
Thank you.
Thanks.
Ms. Rodriguez, do you have anything to add to that, or just board updates in general? Okay. Well, thank you. So, go ahead.
Oh, I was just going to say, sorry that I missed last meeting. I was away at a conference, but I really appreciate hearing the feedback. This meeting is really valuable to me.
All right. And that leads us into the last 30 minutes where we do want to hear successes and feedback from the sites now. So if you guys have any questions or comments, this is a great time to bring this up so we can work on those going forward. And at the very end, the last 5 minutes, I'd like to go over some upcoming district and county events. So if anybody would like to start us off here about their site or have any comments or questions, and this is more of an open forum. I know, again, we did address, we received the input about the paras last month. So if there's anything additional, you can obviously add to that. But if there's any other topics you would also like to talk about. Carrie from Cabrillo, you are up.
Hi there. I missed the last meeting too, and I apologize. I just wanted to say it was really great talking with the principal and you, because I think it is super effective to have the principal involved in this, and Dr. Dawes at Cabrillo is super great with getting involved. I wanted to say something about electives since we were talking about it. We accidentally stumbled upon leadership as an elective. Now my daughter's not in it yet, but she applied for it. It's only for 8th graders at Cabrillo, and it was something I never would have thought of doing for her because she's not a leader by nature. But after talking with the teacher, and she was saying that she accepts all sorts of students, and I think it's something that should be talked about more for kids like us, that they should be able to get into these classes that even me as a parent didn't think was appropriate for her, because you can be a leader, but you can also possess leadership skills, and those can be two different things. So I think it's something I just want to put out there to people who have elementary school students or 6th or 7th graders, if it's not too late. It's an 8th grade class at Cabrillo, at least. I don't know if the other middle schools have that class. The teacher was super welcoming to any type of student, and she looks at each student to see how they can, what skills they have that they can earn, like get these leadership skills for themselves. So again, something that I would never have thought of for my daughter that we're going to try next year. So just food for thought sometimes I personally don't think outside of the box in every way for my daughter, but again, accidentally stumbling upon this class. She's really excited about it, and the teacher is very welcoming to her. And I think it's a great way for inclusion to happen with some of these kids who may have leaders, who are leaders by nature, are going to see some other kids and can see how these kids can work together to solve problems. I think they put on some of the school programs. So something to think about is leadership for our kids.
Thank you. Thank you very much. That's a great suggestion. Ms. Leilum. No problem.
I was going to say something earlier, but for time, I thought I would hold back, but it kind of dovetails a bit with what we were talking about. Just offering a little bit of that high school perspective and experience is that I did find that the pacing of when things were introduced with the IEP to be really effective. And I think, Dora, you might have brought this up a little bit earlier. But I'm glad we didn't really start talking about the future, the job, the college, all of that, until we were a little bit more mature and farther along in the process. We talked a little bit on the side, but we really started implementing it. And my child started really being responsible for the research of this or that. And they could really handle those responsibilities on their own more. And then just recently, we've been kind of going the route more of, okay, what does a job look like? Whether it's part-time right now as you're getting out of high school, or what is that future career? Like, it just felt like the pacing of it was really good, and that our IEP specialist, Ms. Van Wagner, has handled it really well. I've been really impressed with her approach and really putting the onus back on my kid and not me. I mean, I'm there as the guide, but like so much of that independence is critical as they get older. That's
great. Yeah. I mean, it really is, because Carrie was talking about like leadership and this whole aspect of, so there's this balance in general with special education, right? We want to be able to provide them what they need, enough of what they need, but that we're not enabling them in a way where we're giving them too many services, right? Because we want to make sure that they are able to succeed and integrate back into the general education and to generate, have the ability to go into our workforces, when they graduate, right? So there's that balance of providing them the least restrictive environment, and having them take ownership of what they're doing as they get older. And we're not saying that we want to provide them the services they need, right? So that's why we have these meetings, and I'm glad you're saying that, and working with the IEP team and working with the professionals with the input of the parents to determine what are the next steps for each child as we move them forward, for sure.
What might help, I think, is that, to me, front loading is always critical, right? So letting the parent know this is what you're going to expect over the next, for high school, 4 years might be the thing. Like, this is kind of the timeline we work on. We're going to adjust as we go. But that helped me, because I asked about it. I'm like, well, when do we start talking about this? When do we do that? And she's like, this is kind of how it will lay out. And we needed, honestly, for the first 2 years of high school, we needed some pretty heavy hands-on, this is how you succeed in just your classes. So, and good news, like, we've been accepted to college and are probably going to go next year. So it's worked. It's been a lot of work, but it was very effective for us. So I appreciate it.
Thank you. That's great input. Miss Laura Reyes.
So not too much going on over at Poinsettia, other than they had their art night, which was really cool. They're painting the tiles. So that's cool. But I really wanted to share tonight, Buena's having a music night. They're having a music concert, and my son plays in the honors band, and it's amazing. It's like a professional orchestra. So 7:00 tonight at Buena.
Oh, no, that's a great update. So how do they paint? What are they doing? Is it like each kid gets a tile, or how does that work?
Yeah, they get a tile, and then they had last night, they had a couple hours where everybody showed up and they painted their tile and they put it on their wall at the school. So it'll always be there.
Is it like a design or what they want on the tile? Is that what it is? Okay.
Anything they want.
Oh, that's great.
Yeah.
That does sound fun. Miss Herrera, are you ready?
Yeah. So for data, I talked to the teachers, and I know that they've had some meetings with the OT, and they want to finally get that sensory room going. So I'm hoping it's going to be done by this year. It's a long time coming, but that's what they were talking about. I know that we were trying to get some seating and some like shade where the bus stops. So I know that Mr. Cohen was looking at that. He is hosting some he calls them like coffee with Cohen, so parents could come and talk about anything that they need. I haven't had a chance to go. It's actually going on like right now, but I think that's good for parents, and it is bilingual, which is great. That's all I have.
Yeah, and speaking of that sensory room, I've been in discussion with Mr. Cohen too. We have a great list of materials that we're going to order for your site to get that. Our goal is to get it moving as quickly as we can. We do know sometimes things in the current state are back ordered often, but we're looking to really have that going. So thank you for providing that input.
Yeah, well, to be fair, we started talking about this when my child was in 5th grade, and that's what they said. He's promoting this year.
We're actually doing this. We're doing
well,
it.
It would have been nice if he would have been able to walk in there and actually use it.
I understand.
But it's always better to leave the place, to fluff it up, to leave it better for the next incoming students. And I'm hoping that that the other schools, Buena already has one, or Ventura, wherever the high schools are. So yeah, I'm happy that it's finally happening. Hopefully that the 8th grade class, they get to use it as well.
I agree with that. Thank you. Jenna, go ahead.
Sorry. I don't really have a bunch of updates from Elmhurst. I'm not sure if Ashley does, other than the issue with like paraeducators we had talked about in the training and stuff like that. I just really wanted to reiterate that, I know Nick knows, but we've had some issues at our school as far as issues happening with paraeducators. I do want to state that there's paraeducators that are so amazing and who made a huge impact on all of our kids' lives, and they're leaving the school district because the training is so lax, because, the pay is just not enough to survive in this day. I know there's a lot more that comes with that, but I just want you guys really need to be aware that you're losing the amazing people we have, and we need more, and we're losing what we have. So it's unfortunate. I also just want to speak with, as far as events and things happening, I really feel like our kids need to be able to have events. I hear, Buena's having their music or whatever. I don't know if it's our school principal or, whoever, individualized on how our events are being held and stuff, but these kids are not doing anything. It's not fair. It's not they need to get back to being able to have events, doing school night things that happen. And I really feel strongly that it's time. We need to pay attention and get that stuff going again. That's all.
Thank you. Okay, Miss Pope. Oh, go ahead, Miss Murphy.
Sorry.
No, go ahead. I'm jumping.
Once I get going, you gotta mute me. But
no, of course.
Jenna, I will just say a lot of that is individual site, right? We allow site leaders to make a lot of those choices, and so as a parent, that's really the place where you would have the best chance to advocate is with your principal. Because we have sites, Point City is a good example, right? They're doing overnight campouts and other school sites that don't feel comfortable doing that. So that's definitely a local school community issue. And if you have any questions, feel free to reach out to me. I'm happy to help.
I appreciate it. And I just really want to reiterate with the para thing. That's huge for me right now. And I'm going to advocate as hard as I can for the para educators, because I'm baffled and I'm really hurt that we're losing a couple that we know so well and are so they should be trainers in para educating. And there's no position to be a trainer of the paras, and there should be, because there's amazing paras out there that could be helping train what we already have and stuff. So anyways, that's it.
And I know you've heard this from me last month, but it's hard to trust the process that we're currently in. But we have made we're doing a lot of things right now to really look at the concern you have for them leaving. We're really looking at that, and we're looking at a few other aspects of those. The training is a huge piece. So I just want to let you know, Ms. White, that I understand that it feels like the process is moving slowly, but we are really considering this. It's very important that you brought this input to us, and you guys brought this input to us in the previous, not just last meeting, but previously. So these are things we are looking into. Thank you. Let's go with Ms. Pope.
Okay. I also just want to touch on the employee thing. I know it's not just the school district, it's every single business is struggling with employees. In addition to paraeducators, one I really wanted to call out is transportation. For a lot of the special education kids that take the bus on the way to school or not to school, they're having substitute bus drivers that maybe aren't using the transportation app. And so as a parent, you're used to kind of looking at the app, you know, your kid's coming home at a certain time, and then they're not home when they normally are. They're 10 minutes late, and you look at the app and there's no movement. So just making sure that as people are coming in to sub, that they're held to a particular standard. I've heard from a couple parents that they've had an experience like that, and it's the scariest thing when your kid is not home 15 minutes from when they normally are. They don't speak because they don't have a phone. They don't have any way to contact. They can't really tell you what happened in those extra 15 minutes. And all you can do is text to the teacher and be like, did my kid get on the bus? And get a yes. And then you're just kind of waiting. So that is one that I definitely wanted to call out. I'm going to give one more plug to the K-8 thing. I really think that as school of choice became open this last year, where kids could opt into a K-8, even if they're not from that school, it does become kind of an equity and access thing. If all kids have access to K-8 except for Mod Severe. And I just think that it could be the easiest fix to open up to classrooms that do serve 6th, 7th, 8th grade on one of these school sites. And I think that the district has some liability if that does not happen within the next couple years. And lastly, on a positive note, I wanted to give a huge shout out to Miss Barry at Elmhurst. My son's class came home with the biggest envelope full of Valentines from the general ed class that they do integration with. It had like one from every kid. So there's 30 Valentines in there. Tons of candy, so many handwritten notes from all the kids to my son. And I know the rest of the kids in his class got them as well. And it just really warmed my heart, because those are the types of experiences that we don't get as special education families. We don't get to hear how their Valentine's Day was. And it was just so fun for my son to come home with this crazy big envelope with so much stuff stuffed in there and all the personal notes to him, and get to open those together as a family and look at them and see that he does have relationships. So we were really touched. And I think, I mean, obviously you can't multiply individual teachers, right? We don't have a clone machine, but I just feel like that's a really great example of those long-term impacts that I'm sure her kids are going to go on to 3rd or 4th or 5th grade, whatever grade they're in, and have a different outlook on what it means to engage with the entire population. So how meaningful is that? And so once again, that's Miss Barry at Elmhurst. Thank you. I hope you hear about this.
That's great. Yeah, thank you. Make sure she gets that information. And yes, we will duly noted on the K-8 and looking at programs, duly noted. Okay, let's move on to Dr. Dreher and then Ms. Reyes following that.
Hi, thanks. This might be a conversation perhaps to be on the agenda, but for next month. But earlier this year, we were asked to give some feedback about roughly $1 million in funding that was given. And there's been this, there was discussion, actually, Marcus came to the PAC meeting in December to give that committee an update, and he was supposed to return in January to discuss what had been approved. I guess it had already gone to SELPA, and then I've kind of been waiting to hear in this committee, and it keeps not being brought up, and I would really love to know what SELPA approved and where those funds were being appropriated.
We did talk about a lot of stuff last month, Dr. Dreher, but I believe I did touch on that. We looked through that, or we discussed some of those things, but again, we can put it back on the agenda for next month if you'd like, potentially to re-go over. And again, we're talking about so many things, we're moving so quick. We did provide a quick update. I don't know if there was a lot of questions surrounding it last month, because you're talking about the recovery money. So yes.
Yeah, I don't recall what we did talk about, but that it was been presented to SELPA. I mean, I have notes that but there was no details on what was had been approved. It kind of sounded like, hey, it's being approved, and then and so I kind of anticipated it being on the agenda today, and it wasn't. So it was brought up, but it wasn't like, this is what's approved and this is how we're going to use the money. So I kind of want like the closure to like, you asked us for our input, a plan was put together. We don't know what that plan actually was. So it was approved. Now, can you let us know what was approved?
Okay. Yeah. Okay. I understand what you're saying. You're saying you want actual more details. Yes.
Yes.
Sense.
Yeah. So, like, how's that money actually going to be used now that it's been approved? I assume it's been approved by SELPA at this point.
So let me check on all of that information. And then, yes, at the next, whatever we can provide you at the next meeting, we will provide you as much detail as we can.
Yeah. And I haven't seen any in the SELPA notes either. I get those meeting agendas too. So that's why I'm circling back here.
For sure. No, that's a good question. So let me talk to Mr. Conant and we'll look at it and see what we can share, and whatever we're able to share at the next meeting, we will do so. So thank you. Ms. Reyes.
Okay, so just touching on supporting our paras a little bit in the training aspect, I just want to say that my sister is a para actually up in Ojai at an elementary school, and they have new curriculum come in, and they did have someone come out from the district. She has a little class where she does reading and math, and the kids come to her. And they were trained, at least in the curriculum part. Now, she may have not have gotten a ton of training on how to handle each kid or to individualize, know each of them, but she did get curriculum training. So I just wanted to put that out there as a plus as well.
That's interesting. And that's, it is great that they could know kind of what is actually being taught in regards to the curriculum part, aside from just the behavioral aspects of the trainings.
And they really are kind of winging it. There is skeleton crews everywhere, and it's just my sister and another para teaching a whole class right now.
Yeah, it is difficult right now. Like you said, there's a lot of vacancies everywhere across the state for sure. So again, we're continuing to look into that. We have provided some trainings. We have some more trainings, and we'll let you know what those are that are going to be coming out very shortly. Thank you. Ms. Herrera.
This will just be really quick. I just wanted to touch on what Ashley said about the K-8 being offered for all the kiddos, right? And I definitely agree that it is an equity thing. It's almost like discrimination against our students. I honestly, realistically, I don't think it's going to happen unless they place a class, one of the programs in there. I'm having trouble just to go tour a different high school, and all that they keep telling me is that's not going to be their referral. So they don't even want to hear about different options that the parent may even have in mind. So then that as a parent, you're like, well, I'm not trying to shop around. I'm not trying to change programs, but I would like to see if there was a different option for my kid. And when we're pushing for the future of every student, and hey, come, school of choice, and we're out there, because I work at a school, we're out there promoting our school. We're out there, hey, yeah, come to our school. Hey, let me give you a tour. And then you just get like, no, it's not going to happen. So I think that's why the K-8 wasn't even thought of for a special ed population. So I agree with her, and I don't think that's fair. And it definitely is an equity thing. And I know we could do way, way, way better. That's it.
Okay. Thank you for that information. Dr. Dreher, did you have your hand's still up? Did you have another comment? Okay. Any other comments about, we have room for maybe one more comment or question or something if anybody else has that right now. If not, we are going to move on quickly to let's see here, some district county upcoming events. The Autism Society of California, in collaboration with the Community Foundation for Monterey County, is pleased to announce that the Matthew Paul Finnegan Memorial Scholarship for 2022-23 application is now open. Eligible individuals must have an autism spectrum diagnosis and be a full-time or part-time student pursuing a career in the field of psychiatry, psychology, statistics, chemistry, math, researching autism supports, or a career which will help adolescents on the autism spectrum. Students can be a graduating senior or someone who has graduated from a high school in California and has been accepted to a post-secondary undergraduate education or vocational technical training. 3 scholarships will be awarded, one for $2,000, one for $1,000, one for $750, and this will be all for the 2022-23 school year. Deadline for application will be April 22nd, 2022, and we will be sending this information out to our community as well, and it will be included in the information from today's meeting on our website. So we have that. That's a great opportunity there to apply for that. And another reminder that our SELPA Equipping Parents to Navigate the IEP Process training is next Monday from 6 to 7:30. And if you are interested in attending, please sign up at vcselpa.org. And there will also be sessions presented in Spanish on March 2nd. And that's it. If there's not any other closing comments or questions on this beautiful Friday in Ventura.
I can just say for the Matthew Finnegan Scholarship, if you think it's like super specific, it is. It's because Matthew Finnegan had these plans for college and then passed away very sadly prematurely, and his family has this fund. And I say that as a board member for Autism Society of California, although I don't think I sent over the scholarship, so somebody else is doing my job here in Ventura County. I also wanted to add that April's Autism Awareness Month. There is Ought to Run coming up on April 24th. It's the last Sunday in April. I hope that you guys can come out. It would be great if each of your schools had a team for Ought to Run, or if you want to have a family team. You guys are all welcome to join my son Gavin's team. And just come out, and it's the largest autism resource fair on the West Coast. So if you could get your school administration to come out as well. So many services out there to learn and to talk to all the different agencies and providers. So that is my plug.
Excellent info, Ms. Pope. I really appreciate that. Great info on that information. And last one, we'll have Ms. Reyes, and then we'll close it out.
Can we just get some kind of link or something to that to be able to share with our school sites?
Yes. Are you talking about for the scholarship piece or
for the Autism Run at the end of April?
Yeah, for sure. Nick, if you can send out, it's AUT, A-U-T, and then the number 2, run.org. Or if you just want to write it down.
Let me write it down really quick.
I can send it to all of you guys, but I don't have all of your emails. I do have yours though, Laura. I can send it. AUT2run.org. Yeah,
ought2run.org. Ought to, and when is that happening again, real quick?
April 24th.
Okay.
And it's at CSUCI.
Okay, excellent. I have that information. So we'll make sure everybody gets that information and we can share it with our schools. So, okay. Well, thank you for coming on today. I always really appreciate, on behalf of Marcus Conance and the Special Ed Department, for everybody coming out. And then if you have any other questions, obviously we're there to be emailed or contacted. And I hope you guys have a great weekend. Thank you and have a good day. Bye.